Tonight, we're going to be talking about blood transfusions in pets. So as Will already introduced, I am Dr. Tasia Ludwik. I'm one of the criticalists at the University of Minnesota. So what that means is that I'm a diplomate of the American College of Veterinary Emergency and Critical Care. So I specialize in treating patients who are very critically ill. So naturally, I'm very interested in blood products and the benefits that they can provide to my patients, as well as any patients that walk through the door. I'm also a member of the blood donor program, which we'll talk about a little bit more at the end of this talk. And most importantly, I am mom to two beautiful little girls and two beautiful Labrador retrievers who are pictured over on the side of my screen here, and one cat named Bagheera. So blood transfusions in pets, when I was developing this talk, I asked my husband, who has zero medical knowledge, involvement whatsoever, which is probably why we get along so well. I asked him, if you had asked me 5 questions about blood transfusions in pets, what would you ask me? So tonight, our goal is going to be to go through those 5 questions that he broached to me when we were coming up with this presentation. So mostly we're going to talk about when a pet may need a transfusion, how a blood transfusion is administered, are there any risks associated to giving a transfusion? And at the end, I'll talk specifically about our blood donor program at the hospital and how we can ask our clients to help. So question 1, when could your pet need a transfusion? So the first and easiest, most simple thing to talk about is when your pet is all of a sudden walking around normal and then loses a lot of blood, and then they require a transfusion. Every time I give a talk on blood products, I include this picture of a little red blood cell here with the 4 hemoglobin molecules attached with an oxygen molecule that can attach to this hemoglobin molecule. So ultimately, this tells us that red blood cells have hemoglobin, which then binds oxygen, which the body needs. So if we lose those red blood cells, we don't have enough oxygen, and the body will have an increased heart rate and an increased blood pressure in order to try and maintain life. So when we all of a sudden lose these red blood cells, the body's response has to be pretty rapid. So when we lose blood acutely, like with trauma, or your patient was hit by a car, was attacked at the dog park, some sort of acute loss of blood, then we have very, very severe clinical signs very quickly. Another possible cause of acute blood loss would be rodenticide toxicity or some sort of a coagulation defect. So your pet maybe gets into rat bait that is in the neighbor's garage, and some mouse poisons and rat baits contain an agent that stops the blood from being able to clot. And then those patients can start bleeding, in which case they would require a blood transfusion. Another possible cause of acute loss would be bleeding into the intestine or the stomach. Sometimes we can see patients who get really, really, really sick really quickly and have a lot of inflammation in their stomach and their intestine, and they have so much inflammation that they can start bleeding. Or if they're on a chronic non-steroidal anti-inflammatory medication like ibuprofen, which is essentially the kind of dog equivalent of Advil, they can develop ulcers over time. And the simplest answer to blood loss is a patient who has intentional tissue trauma because they're undergoing surgery. So whether or not they're being spayed or having a foreign body surgery or any other type of intervention, we can absolutely have a loss of blood when patients are undergoing surgery. There's also some more chronic causes of blood loss, 2 of those being caused by the immune system, so autoimmune diseases. And this is where the immune system actually attacks its own red blood cells and platelets. So if the immune system attacks its own red blood cells, that's called immune-mediated hemolytic anemia. So the picture kind of on the bottom here is where this little red blood cell is attached with antibodies, and then it's marked for destruction. That sounds very dramatic, but it's marked for destruction by the spleen, and then that is essentially no longer a functional red blood cell. So this can occur pretty acutely in animals, or it can be kind of have a slightly more chronic presentation. An immune-mediated platelet destruction can also occur, which is where the body destroys its own platelets. Without platelets, we can't form a blood clot. So without a blood clot, a patient can bleed from just a small amount of trauma or a little bump or a little bruise. Now, Infectious diseases can also cause a patient to lose blood or become anemic. Some things that are borne by a tick, so gets bit by a tick, potentially can get something called babesia. Another disease is mycoplasma. These are all infectious diseases that they can pick up in the environment. And in small puppies and kittens, we can see really large flea burdens and intestinal worm burdens, which also can cause an anemia. Now, with more chronic diseases or diseases that occur over a patient's lifetime, they may have kind of blood loss from their intestines or their GI tract that can last for quite some time. So they have more time to compensate for those changes. So we may not notice that they need blood or that they're anemic until they're very severely anemic because it happens over a longer period of time. One of those examples is patients with kidney disease. The kidneys are really awesome and they produce a hormone that helps to increase the rate of blood cells produced from the bone marrow. And when kidneys are diseased, they don't produce it as often. So these patients can become anemic over time. And intestinal disease with chronic patients, they kind of lose the normal healthy barrier to their intestine. And with that can lead to more significant changes and bleeding if they have any sort of a GI upset or a vomiting diarrhea episode. And lastly, things that patients are born with or congenital diseases. The two most common ones are diseases where the patient is born without proteins that are necessary for normal blood clotting. Now, you guys may recognize these diseases, von Willebrand's disease and hemophilia, because these are also diseases that humans can get. So this is something where the patient doesn't have these when it's born. So essentially, if it ever is in a situation where it's losing blood, it can't clot. So this is commonly interacted when we have a patient who goes in for a neuter or a spay procedure or even a dental or suffers some trauma. So is at the dog park and gets bit by another dog and it comes in and it can't stop bleeding. And then we're like, I wonder if it has some sort of a congenital bleeding disorder, which can test for it, but oftentimes that we don't know they have it until they show up and they're bleeding and they need blood. So those are some reasons why a pet can need blood. The second question posed by my non-medical husband was, do dogs and cats have blood types? And the answer is yes, they do. So dogs have 8 different blood types, and it's based on a cell membrane receptor on the surface of the red blood cell. So there's 8 different receptors. So there's 8 different blood groups. But we really only care a lot about DEA 1.1 because that is the one that tends to cause problems in our veterinary patients. And by problems, I mean transfusion reactions, which we'll talk about later. But for right now, the important thing to remember is that there's 8 different blood groups. 1.1 is the most dangerous, so the one that can cause the most reactions because it is highly antigenic. And the rest of them tend to cause decreased survival of the red blood cells. So if they get a transfusion of a type that is not their own, the cells don't last as long, but they don't cause a severe reaction. So a universal donor is a patient who is negative for that DEA1 because they can give their blood to other patients. Now, the cool thing about dogs is they are not born with any antibodies towards those other blood groups. So no matter what their blood type is, they're not born with any special antibodies against the other groups. So if they've never had a transfusion before, they can get one freebie transfusion of non-type matched blood. Now, this is really exciting for me as an emergency clinician, because if I have a patient who comes in and needs blood immediately, then I don't have to wait for a blood type to come back. If they've never had a transfusion before, I can give them one transfusion of non-type matched blood without a reaction. Now, that is not the case for cats. Cats, as with everything else, are special, and they do have these naturally occurring antibodies. So cats cannot receive a unit of blood that is not their blood type. So type A cats are born with a little bit of anti-B antibodies, and type B cats are born with a lot of anti-A antibodies. So we have type A, type B, and type AB, and type AB cats lack both antibodies. So ultimately, cats can't get blood from another cat that is not their same type without having a reaction, because they do have these naturally occurring antibodies. A type B cat that gets a type A blood, since they have such high levels of antibodies already to that blood, would likely be fatal to that cat, because they would destroy that blood. Those antibodies, as soon as it enters the cat, the antibodies would attach to the red blood cell antigens and cause lysis of the red blood cell, which would then cause a widespread inflammation in the patient and likely result in death. So it is very important that cats get their own blood type. So because of that, there's no universal feline donor. So how do we know what blood type they have? There are different methods for blood typing. And then we also have something called cross-matching, which cross-matching tests for things that can cause a reaction that are not evident in the blood type. So with blood type, we use these cards here. So there's a card for canine DEA 1.1, and then there's a card for feline A, B, or AB. So there's an autoagglutination screen, because that is how we tell whether or not they are forming agglutination. And then we have a positive control, and then we have the patient test. So this patient we can see is agglutinating in the positive control, and it's not agglutinating in the patient test. So it's negative for DEA 1.1. This patient, agglutinating in the positive control, agglutinating in the patient test, positive for DEA 1.1. Kitty cat over here is agglutinating in the type A. It is a type A cat. Now, the cross match over here is kind of also fun to explain. So the blood is centered on top of here. The blood of the donor and the blood of the recipient are combined in this little gel tube. So in a normal cross match that's compatible, meaning there isn't any agglutination, their cells don't stick together. So if they don't stick together, they can freely squeeze their way down through the gel. And that's what we want. We don't want the cells to interact and stick together, because that means there's antibodies. If the cells interact and stick together, they cluster at the top of the tube and they don't make their way through the gel, which is what we don't want. That tells me that there's a reaction to those cells because they're clustering together. So these are things that we're doing before we're giving any patient blood, so we can make sure that they get the right type of blood that's compatible for them. So then how are we giving the transfusion itself? The first thing we need to ask is, what product do we need? So when we take blood from a patient, or any animal donates blood, or we get donor blood from another patient, it starts out as whole blood. And whole blood is a combination of red blood cells and plasma fluid that's in our body. So that combination is essentially whole blood. Now, some patients need whole blood. So if you experience a trauma or you experience surgery and you have a lot of rapid blood loss, then you're losing your red blood cells and your plasma. Your plasma contains all those clotting factors that are important to help your blood clot. So I really need those if I'm bleeding. If I just give packed red blood cells, I'm not giving any of those clotting factors. So what I need to give is both. So those patients who have acute blood loss often need whole blood. Now, when we take the blood, we then put it in a centrifuge and we spin it down and we separate it into packed red blood cells and plasma. We do this because it stores longer as packed red blood cells and plasma. So we can then pull out packed red blood cells, which is just red blood cell portion of the whole blood, or we can pull out plasma. So if I have a patient who is anemic, but doesn't need those clotting factors, I can give them just the packed red blood cells. If I have a patient who has a clotting factor deficiency, but is not anemic, I can give them just the plasma. So I can give them those components and they're able to be stored for longer, depending upon the reason I'm giving the blood. We can also make very specialized products in our blood bank. So for example, if we know a patient has von Willebrand's disease or a hemophilia prior to surgery, we can take that plasma that has all the clotting factors in it, and we can centrifuge it down to a much smaller volume product that we store and have ready for that patient prior to surgery, so that when it comes out of surgery or it's in surgery or before surgery, we can give it this concentrated product that's made just for them. So it has all those concentrated clotting factors that that patient is deficient in. So that is something that we can make ahead of time in advance, but we don't commonly store. Now, once we've decided what product the patient needs based on what disease they have, then we have to decide what type we're giving them. So we've pre-transfusion tested them if they've had a transfusion before and they're a dog. We know they're a DEA 1.1 positive or negative. So I want to give them their same blood type. If it's a cat, I'm always going to type them and I'm always going to cross-match them before I give them a transfusion so I can make sure they're getting their blood type. Type B cats are pretty rare, so it's uncommon for us to have B blood in the hospital. So often we just carry type A cat blood, but we do have access to type B cat blood if we need it. Now, the right type is important, most for cats. If a dog has never had a transfusion before, they can still get a transfusion without having a blood type. But if they've had a transfusion, then we have to get a blood type before we can give them a transfusion. We will also cross-match them against any other reactions before they get a transfusion so that we can minimize the risk of them having a transfusion reaction. Now, I want to also give this blood at the right time. So blood is not benign. It comes with risks, which we'll talk about. And this isn't blood from the patient's own body. So if there's any chance that we're giving a patient something that doesn't come from its own body, there's a risk that the patient is going to have a reaction to that. So we want to make sure we give it at the right time. So in the very beginning, when we were talking about why a patient might lose blood in a very fast way, we talked about things that happen in the body that tell us that it's trying to move the oxygen around faster. The heart rate comes up, the blood pressure comes up, the patient's going to be weak because they're working harder to move what little blood they have around. So if I see these clinical signs in a patient who's anemic, I know that they are going to need a blood product. If I see a patient who's anemic and they're happily wagging their tail, they have a normal heart rate, they're resting comfortably, they're able to walk around the exam room without any weakness, that patient is doing pretty good. And the risk of giving a transfusion may outweigh the benefit for that particular patient. So we really have to balance the need for a transfusion with the risk of that patient having a transfusion reaction. And then when we have decided that, yes, they do need a transfusion, then we have to give it the right way. So blood products are a natural product. And because they're a natural product, they are a target for bacteria. So bacteria love warm blood. So what we want to do is keep everything as clean as possible, both coming from the donor pet and going into the recipient pet. So we have a dedicated bloodline with a dedicated filter and a dedicated delivery system. So nothing else is going while the blood is going. We're minimizing how much we're touching that transfusion. And we have a product that's been appropriately vetted and stored and checked for any abnormalities prior to going into that patient. And then we have trained staff on staff 24/7 to monitor these patients when they get a transfusion. And over on the side here, I have an example of a transfusion record that records the patient, it records what blood it's getting, it records what donor it came from so that we know that patient had a transfusion from that donor previously. We take the patient's temperature, heart rate, blood pressure, respiratory rate before we start the transfusion. And then we're monitoring that patient very frequently during the transfusion process so that we can pick up on any changes in the temperature, heart rate, blood pressure during the transfusion and stop if needed and assess whether or not that patient is having a transfusion reaction. So on to our next question. Are blood transfusions safe and what are the risks? I've alluded previously that blood transfusions are not always safe, and there are risks to giving a blood transfusion. However, the risk for giving a blood transfusion to a patient who needs a blood product and has been appropriately blood typed in a hospital setting is quite low. It's less than 5% that they're going to have a reaction. But if they do have a reaction, there are certain types of reactions that we worry about more than others. So the transfusion reaction that is the most problematic is a hemolytic transfusion reaction. This is the reaction that we are trying to eliminate when we blood type and cross-match these patients. So this is where the recipient's immune system attacks the red blood cells that we're trying to give them. So if that patient has existing antibodies that are going to bind to that red cell as they are up here, we want to know about that before we give them that blood. So that's why we're doing the blood type, to tell what kind of antigens are on that red blood cell. And we're doing the cross match to detect if that patient is going to have any sort of reaction to that blood product. Now, if the patient's immune system attacks the cells, one, it makes that blood product not useful for that patient anymore because the blood has been destroyed. And two, when those red blood cells are lysed, they release a lot of really inflammatory products that cause a lot of damage to the body. So these can be fatal reactions, which is why blood typing is so important in these patients. And these are things that we minimize by doing appropriate transfusion screening. Now, on the less severe side, we have allergic type reactions. So this little fella down here in the corner is having an allergic reaction. His little muzzle is swollen, his eyes are red and swollen, and sometimes they can develop kind of urticaria or little raised bumps around their head and chest and arms, itchiness, just similar to if your pet was having an allergic reaction from stepping on a bee or eating a food that they're not having if they are eating a food they have a reaction to. So any sort of allergic reaction can cause these clinical signs. Now that's a mild reaction when their face kind of gets a little swollen. Dogs aren't like humans in that their face swells up and their neck swells up and they have trouble breathing when they have an allergic reaction. Dogs tend to manifest their allergic reaction in their intestines and their liver. So their clinical signs of a very severe reaction are high heart rate, low blood pressure, collapse. So that can still occur even if we appropriately type and cross-match a patient, because it's to the proteins in the blood product, not necessarily to the blood type. So this can happen to any patient given any blood product. So anytime we're giving something that the patient has not seen before, there's a risk of this reaction. The risk is very low for this particular type of reaction, and it can vary from very mild with the facial swelling to severe when we have the more anaphylaxis reaction where they collapse. And there's also reactions that are not from the patient's immune system at all, but just from underlying disease. So the patient maybe has kidney disease or heart disease, so they can't tolerate the volume that we're giving them in the transfusion. So if they have underlying heart disease and we have to give them a blood transfusion, we're adding more fluid to a system that already is very intolerant of fluid. So they can get overloaded with that fluid. The product could be contaminated. So if for some reason during the process of collection to administration, there is bacteria introduced into the product, then it can be contaminated and cause sepsis or infection in the blood of the patient. Or there can be electrolyte imbalances, which really we only see when patients get lots and lots and lots of blood product because of the additives that we put in the blood product. So with that being said, transfusions are not benign, but the risk of these severe reactions is quite low. And this is why it's so important that we appropriately select patients who require a transfusion, because transfusions can be absolutely life-saving and we give them every day, but we want to make sure that the risk of getting the transfusion is not more than the benefit that the patient will receive from getting that blood. So now where do these blood products come from that we're giving? Volunteer donors. So the University of Minnesota has a volunteer blood donor program. So clients and staff can sign up to have their pet donate blood. So dogs and cats can donate blood. And then we maintain this stored volumes of blood in our special blood bank. And then we make sure that it's preserved in the quality and under very carefully controlled conditions and monitored for quality very frequently. So these patients, before they can become a donor, receive a physical exam by a veterinarian of the blood bank. They receive testing for infectious diseases. As we talked about in the beginning, there are certain diseases that are transmitted in the blood, and we want to make sure that any donor doesn't have these diseases because we don't want to pass things from one pet to another with a blood transfusion. And then they receive sedation for the blood donation and collection about every 6 to 8 weeks for dogs and every 3 months for cats. So then we have volunteer members of the blood donor program who come in and they help collect the blood, and then they process the blood for storage. So some of the blood is left as whole blood, and some of the blood is processed into those red blood cells and plasma. And then if we are aware of any patients who need those specialized products, we can make those ahead of time as well. And then red blood cell products don't last forever. We can only store them for about 30 days, but ideally we use them within about 2 to 3 weeks. Plasma products and blood products both have to be maintained in a very dedicated storage space under very carefully controlled conditions. Prior to the start of this, we were talking about, I don't know if anybody watches The Pit, but it's like all the rage now, and how the blood storage in that episode was an issue. And that is certainly something that we can encounter. So we have a thermometer in our blood fridge, and we're monitoring it extremely closely because any changes in that temperature can compromise the integrity of the product. So if we don't have transfusion donors available, or a pet isn't able to get a blood donor transfusion, we also have other options that are non-donor options. So one option is an auto transfusion, and this is where a patient receives its own blood after collection from a body cavity. So the picture here is me and a colleague performing an auto transfusion in a pet who ate rat bait that caused its blood to not be able to clot. Because its blood couldn't clot, it bled into its chest. So it had a chest full of blood. So what we did was we removed that blood from the patient's chest, and then we gave it back to the patient in their vein. So it sounds pretty cool. And it's something that we do routinely in patients who need it. So the nice thing about an auto transfusion is this is the patient's own blood. So they're not going to have a reaction to it because they're getting their own blood back. There are certain reasons where we wouldn't want to do an auto transfusion, but if possible, we prefer to do it this way because the patient can get their own blood. Another option is autologous blood donation. This is if a patient is known to be going to surgery. So if they're going to surgery and they're going to have a surgery that's going to expect some blood loss, potentially like liver surgery, then what we can do is have them donate their own blood 2 weeks prior to surgery. So they come in, we do a collection of their own blood 2 weeks prior to surgery, which gives their body time to rebuild those cells. And we have that blood available, that this is the patient's own blood, so that if it starts bleeding in surgery, we can give it its own blood. So with those options and the donors and everything else that we've been talking about, I'm sure you're wondering if your pet could be a blood donor. So there's some specific requirements that we have to talk about when considering whether or not a pet can be a blood donor. One thing is their age. So dogs between 1 and 6 years of age are considered, and cats between 2 and 6 years of age are considered. Cats have to be at least 10 pounds and dogs have to be at least 50 pounds without being overweight in order to donate the volume of blood that's required. They have to be friendly and not easily stressed. So they're coming into the hospital, they absolutely are getting all the snuggles and love when they're in the hospital, but they have to be able to come in, let someone else other than mom or dad handle them. They do get sedation, and then we'll collect their blood. So we try and give them minimal sedation. So in order to do that, they have to be a friendly pet that's not stressed. And they have to be healthy. So up to date on their vaccines, negative for heartworm disease, negative for tick-borne diseases. These are all things that we confirm during the screening process. Cats have to be indoor only. They have to be FIV, FLV negative, and that includes all housemates. And they can't have any underlying diseases that would potentially predispose them to having trouble with any sedation. There are benefits to being a donor other than saving other pets' lives and being a hero. You also get food, a complete physical exam by a veterinarian, blood screening that you'll have a copy of, regular blood work, a 12-month supply of flea and tick preventative every year that you donate, free blood typing. So if your patient ever needs a blood transfusion in the future, you know what blood type they are. And it is a big commitment, but it saves hundreds of lives when your pet becomes a blood donor. So lastly, I will give a plug for the UMN blood donor program. We're always looking for dog and cat volunteers. We do test them and prefer universal donors because they can give blood to anyone. But we also, other than just the donors that give the blood itself, we also need program supplies and equipment maintenance. As I was saying about our blood donor fridge having to be maintained under very strictly controlled conditions, we often need supplies, and we actually are in need of a new blood donor fridge. So these things have to be kept up to date and make sure they're functioning very appropriately. And we also have to have a backup plan, because if our temperature drops in our fridge, we have to move all of our product into another fridge within about 5 minutes to make sure we don't lose the integrity of our product. So if you're interested in learning more about the blood donor program or being a part of the team, you can email this email here, and I'm sure will include this in the questions portion and the information at the end as well, if you're interested in having your pet donate blood or just interested about learning more about the program. So with that, I will take any questions about blood donations in pets. Thanks, everyone.
All right. Thanks, Tasia, for your time and the wonderful presentation. So we'll start with pre-submitted questions first, and we welcome Q&A questions on Zoom, and we'll get to those as time allows. All right. So the first set of questions here is asking, how long can donated blood be stored, and what does one do with expired blood?
Yeah, that's a great question. So red blood cells can be stored for about 30 days. Ideally, we use them within about 2 to 3 weeks. And any blood that doesn't get used we have to get rid of it. We can't do anything else with it because it's not safe to administer to a patient. So blood that doesn't get used gets thrown away. It's very rare that we're throwing away blood because we go through quite a bit of it. Sometimes we go through a ton. Some days we don't go through as much, but certainly our part of the job of our blood bank committee is to balance the needs of the hospital and the risk of sedation and collection on the donors. So we want to make sure we're collecting the donors often enough that we have enough supply for the hospital, but also not collecting them so much that we're throwing away product and taking too much blood from our donors. So it's quite a balance that the blood bank manages, but it's a great question.
Great, thank you. This one is asking, what is the average cost to transfuse 1 unit of whole canine or cat blood?
That's a great question. So whole blood, to transfuse whole blood is about $2,000. Packed red blood cells and plasma is about half that. So $1,000 for packed red blood cells or $1,000 for plasma. So that is just the product. That does not include the hospitalization and the monitoring and the administration of the product. So it is not a cheap therapy, but it is often life-saving. So it is something that we always make sure that we have available to our patients.
Great, thanks. Looking at another one here about blood donor criteria. Are animal blood donations broken down into components like human blood donations are? In other words, are there donations that only extract the platelets or plasma, or are the donations whole blood and then broken down into components?
Yeah, that's a great question. So they are broken down in some instances. So sometimes we do preserve whole blood, and we do that because platelets are extremely finicky little things. And as soon as we start to process blood, we reduce the functionality of the platelets. So the most functional platelet is going to be found in fresh whole blood. So if I have a patient who's bleeding, I want to give them fresh whole blood if they're having acute rapid blood loss. Now, when I spin down that blood and put it in packed red blood cells and plasma, those platelets aren't as functional. So we don't do platelet-rich plasma. It's a possibility and we can do it, but we know that when we process those platelets, they're less functional. So we prefer to do the fresh whole blood. But we do spin down and process blood just like in human medicine, and we do have the ability to kind of split it into the components as needed for whatever disease we're treating.
Awesome. That's good to know. Thank you. This person asks, can you speak more about any negative consequences of transfusions? How often do negative reactions occur, and might they be fatal?
Yeah, that's a great question. So transfusion reactions are pretty uncommon, less than 5% for the severe reactions and about less than 15% for the moderate reactions. So they can be fatal. However, the fatal transfusion reactions are minimized when we do appropriate typing and cross-matching of the patient and make sure they get the appropriate type of blood that they need. So we do a lot of donor testing. We do a lot of screening of our product. We do a lot of stuff to maintain the integrity of our product. We check for hemolysis before patients are given it. So the blood bank team does a lot on the front end to prevent any of these reactions from occurring. That being said, it is still possible anytime we give a transfusion. It is associated with risk, but the fatal reactions are pretty rare.
All right, thanks. Someone is asking here about blood banks. Are there local or regional blood banks for blood products for animals similar to the Red Cross or Memorial Blood Center? And then I guess just answering that in relation to the VMC's own blood bank.
Yes, there are. So the VMC has a blood bank. There are other hospitals in the area that also have blood bank availability. And there's also national blood banks. So for example, there's a shortage in albumin right now, and we use a lot of albumin in our critical patients. So because of that, we've been having to use a lot more plasma because that plasma contains albumin, even though it's in smaller amounts. So because we're using so much plasma, we have now ordered product from a national bank, so we don't have to draw more from our donors. So if we know about the need in advance and we can order a large volume of product, plasma we can store for longer, so we can order that plasma and have it available for our patients as needed. So yes, there are national programs we can order from. The downside is it takes weeks to get product often. So when I have a patient who gets hit by a car and I need blood right now, that's not an option. So an in-house blood bank is much more efficient for those cases.
Well, that's good to know. Thanks. This one is asking, what should an average pet owner know about something called fractionated blood products, if anything? And that's a new term to me. For example, packed RBC, platelets, FFP, cryo. So the question is, what are fractionated blood products and what should the owner know?
Yeah, so fractionated blood products are essentially, as I kind of was talking about before, is when we take the whole blood and we separate it out into its components. So really what a pet owner should know is that it's possible to do that. And we do have the capability to do that to meet the needs of the pet. So depending upon if they just need one, if they need the other, if they need both, we have the capability of giving them kind of whatever they need based on what they're presenting for.
All right, thank you. So we have a question here. Do blood types stay the same for an animal throughout their course of their lifetime? Is it prudent to have your animal tested for their blood type early and then keep it on file, say in your wallet or easily available?
Yeah, that's a great question. So the type stays the same throughout the pet's life. However, if they've received a transfusion, they will develop antibodies against that transfusion type that they received. So dogs ultimately are safe with one transfusion. So we don't have to know their blood type for one transfusion. If they've had that one transfusion, we're going to have to cross-match them every time we give a transfusion. So even if we know their type, we don't know what antibodies they've developed against other products. So we're still going to cross-match them to whatever product we give them. So I would say oftentimes the type doesn't take us very long to acquire. Cats, it would be nice to know their blood type sometimes, because if you know your cat needs a transfusion, you can call around and see if they have type B blood, for example, because we don't often have it on hand. So if you have a really lovely cat and you're getting your routine exam done and you want to know, is this a type A or type B cat or an AB cat? It wouldn't be a bad thing to know your cat's blood type, so that if you're ever in an instance and you need to know the type, you can. We are still going to recommend cross-matching the cat before we give any sort of blood product, just to make sure there's no reaction or minimal reaction. But I would say probably not as helpful for dogs, but definitely helpful for cats.
Great, thanks. Cat owner is asking theoretical question. Can an AB cat receive A or B blood?
Yes. So AB cats don't have antibodies against A or B, so they can receive, most often we give them type A blood.
Good. Question here generally about elective procedures. Do you ever perform transfusions for an animal that is having elective procedures?
Yeah, that's another great question. So that was kind of coming along to that is where we were talking about the ability of an animal to donate their own blood before a procedure. So if I'm having like an elective surgery on my liver to remove a mass on my liver, and I know that could bleed a lot, it would be prudent to contact the blood bank and say, could I donate blood prior to this event so that blood's on hand to give during surgery if my patient has blood loss. If we have a patient undergoing an elective procedure and they're not anemic and they're otherwise healthy, there's no benefit to giving the blood prior to them undergoing surgery. because they could have a risk of transfusion. And if they're not clinical for the transfusion, we wouldn't give it. That being said, if they're anemic, even if they're normal prior to surgery, going under anesthesia can change their ability to respond to that anemia. So we may consider giving a patient a transfusion if it's anemic from a chronic disease and it's undergoing an elective procedure.
A lot of nuance. Thanks. Good to know. Question here. How long does a blood donation typically take? How much volume of blood is collected?
Yeah, that's a great question. So blood donations are very fast. They occur within about 30 minutes to an hour, depending upon the size of the dog. Cats tend to take longer because we sedate the cat, we place an IV catheter, and then we collect the blood. So cats were collecting a smaller volume and dogs were collecting a little bit of a larger volume. And then we'll spin it down and do all the processing. So I would say all in all, start to finish, probably 30 minutes for both.
On the case with the dog where you were removing the rat poison, how did you remove the poison before you recycled the blood?
Yeah, that's a great question. So the poison itself isn't in the blood. So what that particular poison does, it's essentially similar to warfarin that's given to humans that stops them being able to clot their blood. So it doesn't, it's the poison itself doesn't stay in the blood. It's essentially just inactivating those components. So giving the patient back the blood, it still has those active red blood cells that it needs, and it's not recycling the poison per se.
Oh, interesting. Okay, here we go. Do your patients ever need just platelets? And in what instance would that be necessary?
Yeah, that's a great question. So rarely do patients ever need just platelets. If they need just platelets, so if they have like an immune-mediated disease that attacks platelets, often that manifests in them bleeding from some surface. So we will often give those patients blood products to kind of bridge the gap until their body can produce more platelets. If a patient needs just platelets, we would prefer to give them whole blood because that's the most active platelet. And we don't want to do that to a patient who doesn't absolutely need it because they might not need the volume, they may not need the other components, there's a risk of reaction, all of those things. So we don't give platelet transfusions unless a patient is bleeding into a life-threatening area, like the lungs or the brain. So even if your pet has low platelets, we wouldn't give it a transfusion of platelets unless it's bleeding in a life-threatening way.
All right, thanks. Question here. Do VMC clinicians ever transfuse blood in horses or other large animals?
That is a great question of which I cannot answer because I strictly do dogs and cats. And our blood bank only manages dog and cat blood. So I'm gonna have to pass on that question.
That's true. Yep. And we do have our Piper Equine Hospital just up the road from the small animal hospital. So we'll get another equine clinician on and they can
Yes.
talk about that too. So question here is a particular condition question. So it might relate to a particular animal. So you could answer it more generally if you need to. Would you prefer to give PRBC or whole blood for an anemic patient that's presenting severe mange?
I would say an anemic patient, packed reds or whole blood, it really depends on their volume status. So what I mean by that is like if they're super, super dehydrated, or if they have other things going on, or if they can tolerate a larger volume, I would give whole blood. If they are just anemic and otherwise kind of have normal blood volume, or I'm not worried about a clotting issue, then I would give the packed red blood cells.
Great. Question here. How, if at all, does the College of Vet Med or the VMC partner either with a blood bank or just through the course of clinical care with rescue animals in the area? Do rescue animals receive blood transfusions?
Yes, rescue animals absolutely can receive blood transfusions. They are treated the same as any other client pet. We work with the rescues to give them what they need, and the rescues do receive a discount as well. So we work with them just as we would any other client, and if they need a transfusion, then they get one.
All right, we've reached the end of questions, Dr. Ludwik. Thank you so much for your wonderful presentation. Thanks, Megan, for your tech support, and all of you for attending. If you attending tonight feel inspired to support the hospital on Give to the Max Day, tax-deductible donations in any amount help clinicians like Dr. Ludwik and our team invest in critical equipment and innovative procedures to provide the very best patient care. So you can scan the QR code or follow the link to make a gift online to help us reach that $35,000 match if we get 200 gifts by midnight. So thank you so much for considering and for your time, and we wish you all a pleasant evening. Thanks so much. Bye-bye.